Biomarkers in CLL, in terms of predicting response to therapy, are still important, but they've been somewhat neutralized, in particular by the Bruton's tyrosine kinase inhibitors, where whether you have high-risk genetic markers or low-risk genetic markers, patients, the medications sort of neutralize their negative impact. The same can be said for a marker that we looked at in chemoimmunotherapy, the Notch mutation, where in the past we would worry about patients with CLL who had this progressing on to developing Richters. With the BTK inhibitors and starting patients on those versus chemoimmunotherapy, that risk of Richters has gone away. I think as we look to the future of where biomarkers are going to help us, as we develop targeted therapies, these diseases, CLL being one of the most stealthy ones, can outsmart the drugs, whether it be a BTK inhibitor such as ibrutinib or acalabrutinib or venetoclax, the BCL2 inhibitor. The CLL cells outsmart these diseases through distinct patterns, and by molecular testing, we can identify these and potentially direct patients toward a more appropriate therapy earlier in the course of their relapse, where it's going to probably be easier to get control of their disease. And that's a research approach that that our group at The Ohio State University have been taking, say with looking for early molecular relapse in CLL with targeted therapies.